Welcome to Connecticut eHealth Podcast, educating, conversing, and connecting for better health. The Connecticut eHealth Podcast is a space where we get together with local and national experts, key stakeholders, and other individuals in the space of eHealth to discuss health information in Connecticut and around the country. This podcast is brought to you from the UConn Health Interoperability, Innovation, and Learning Lab, where our mission is to promote the optimal adoption and use of eHealth by providing education and engaging in conversation with leaders to create connections for better health. So let's sit back and get connected. Hello, this is Tom Agresta. I'm a family physician and clinical informaticist at the University of Connecticut Health Center, and I'll be your host for this episode of the Connecticut eHealth Podcast. It's really a pleasure to welcome back Jen Sarles, who's the Executive Director for Connie, CP. Connie is our state's health information exchange, and this is really sort of a return visit for Jen. We are now 14 months out, I believe, from the launch of our state's health information exchange. So this is sort of an anniversary. And we also get the opportunity to welcome Lakeisha Moore. And Lakeisha has some experience in health information exchange in other states. I'm going to let Jen do a brief introduction for herself, and then we'll have Lakeisha also kind of give some of her prior experience in health information exchange in Delaware and in North Carolina as well.
Thanks, Tom. And I appreciate the opportunity to celebrate the 1-year-ish anniversary of Connie and HIE being stood up in Connecticut. As a reminder, maybe for viewers who remember, I am a Connecticut native. I moved away from the state for a little while to go to school. I moved back in 2006 and have been involved in healthcare and healthcare technology in Connecticut for that entire time. I was previously at what is now called Stone Health, but was St. Francis Healthcare Partners when I was there, the clinically integrated network affiliated with Trinity Health of New England. And before that, I was the CIO at Pro Health Physicians for a number of years. So excited to be here and to celebrate the 1-year anniversary of Connie.
And Jen and I have known each other that entire time. So I've really enjoyed watching her career take off and really lead this effort in a wonderful way. So Lakeisha, tell us a little bit about yourself.
Yes, thanks, Dr. Agresta. Thanks again for having us on the Connecticut eHealth podcast. I am Lakeisha Moore, the Senior Account Manager with the Connie team. And really prior to joining Connie, as you mentioned, I had the opportunity to work with the Delaware Health Information Exchange, and then most recently with the North Carolina Office of Rural Health, their health information exchange, helping to onboard many of our rural healthcare providers. So excited to be with the Connie team and celebrate this 1-year anniversary, 1 year-ish, as Jen said. So we're excited.
Excellent. And as a refresher to our viewers, kind of remind us, and I'm going to ask Lakeisha because she's been in multiple different states. What is the value of health information exchange? Why is it so important to our listeners?
Absolutely. I think as I look throughout the country, because especially in the health information exchange or HIE space, and Dr. Agresta, like I said, keep me honest if I throw out an acronym and you're like, what is that? Because a lot of times we do use a lot of acronyms in the HIE world. But as I look at a lot of the outcomes from the HIEs, I really see such the great role the HIEs played, especially amidst the height of the COVID pandemic, especially with data collection and what we call data enrichment of trying to get race and ethnicity data. Many times at COVID testing sites, just because of the volume, you had a lot of the lab providers that were there, but really the most they could get is maybe like some quick demographic information on the patient. So many of the HIEs were able, because we do have such a rich master patient index, was able to really enrich that data to really say, okay, who are we reaching? Who do we still need to reach? Considering the pandemic was affecting all. So I saw some great work there from the HIEs. I think the other thing too, as we think about now and going forward, as our healthcare system changes from pay per service to more of a value-based healthcare, we need that data in order to really do meaningful population health management. And so I think when we look at HIEs like Connie, they really are going to be the future of our healthcare system. I'll pass it over to Jen though too, because I'm sure Jen, you'd have some thoughts also to share about HIEs and why they're so important.
Actually, can't do much more than that. Lakeisha, I think that was a really great summation. I think it's also important to remember that even in 2022, and even in a small state like Connecticut, and even in a state where we do tend to have a pretty predominant EMR that most of the health systems have, there are still massive pockets of data darkness. And I don't mean that to sound as dark as it just did, but there are still pockets of organizations and providers that are not connected into that larger infrastructure. And it's critical for us to be able to get there. I often like to tell the story of my sort of non-emergent case that I had a couple of years ago, and the struggle I had even with 5 different patient portals to be able to get the screening tests and the results that I needed from one provider to the next. So we see this all of the time in healthcare. We are, on the one hand, so very, very advanced, and yet there are still so many pockets where information needs to get to and needs to flow for the better health of our citizens. So even in today, in 2022, and in a small state like Connecticut, HIE is critical for sort of that interoperability across providers.
That's an excellent summary. And I guess got to ask, when you hit your 1-year anniversary, it was it May 3rd, I believe, was the 1-year anniversary? Did you guys pop a bottle of champagne and celebrate, or what did you do to kind of celebrate the 1-year anniversary of Connie? I kind of think that we're reaching the toddler stage, and the toddler stage is one of rapid growth and rapid change. But what did you guys do to celebrate?
I'm actually embarrassed by this question as the leader of this organization, because we didn't do anything to celebrate. We just put our heads down and kept going to try to get more providers connected. So I think that what we'll try to do is put something on our calendar for next year, sort of when we get to the end of the mandate period for organizations to connect and sort of take a deep breath and see where we are. But we didn't celebrate in that way, I think, because the team that we have, of which I'm enormously proud, sort of was like, yep, it's the 1-year anniversary, but we got to keep going. Folks need to get connected. We've got providers in the hopper. So maybe when we get to the 2-year anniversary, Lakeisha, keep me honest, we'll celebrate with some champagne.
I'm marking the date. I'll get some champagne. Thanks.
All right. Well, I'm going to suggest that you celebrate when you no longer have the terrible twos going on, right, as a toddler. Can you remind us, Jen, why it's so important that we actually have an HIE in Connecticut, and a little bit about the history of how we 48 here and why it is really important to celebrate this, sort of 1-year-ish anniversary?
Yeah, so Connecticut, I think, there's about 48 other states with a functioning HIE, and Connecticut has had sort of some fits and starts around this. I think starting back in 2007, there was the first sort of effort to get an HIE going. And this was sort of before my time really being involved in interoperability in the state. But it sounds like from the history that I've read that it was sort of a cutting edge technology that was well ahead of providers' ability to really take advantage of it, which is a shame. And then I think again in 2011 and 2016, we had some additional efforts to get started on an HIE in the state. And since that time, we've had a number of organizations sort of jump in to try to fill some of that void. I think that Lakeisha made the point of COVID, and I often say that COVID, I think, shone a light in some ways on just how not interoperable we really were in the state. And I think that what I find today when I go and talk to healthcare organizations is they're not resistant to the idea of a health information exchange. They understand the need for us to be connected. Again, there's, from the data that we have, there's sort of 75% of the ambulatory providers who are on specialty EMRs that are not connected into that larger infrastructure that we have in the state. There are a number of FQHCs, federally qualified health centers, who are also not connected into that infrastructure in the state. I like to talk about the Department of Corrections a lot as well. As a healthcare provider who has 17,000 patients with sort of an average length of stay of 2 years, and their health system is not sort of connected into the larger infrastructure that we have in the state. So you still start to see how we have those areas where we've got to get an HIE in, and we've got to get it sort of stood up, which I think we are well on the way there. So I'm confident we will get there to get this interoperability in there. So I think that speaks to some of the importance of why we still need it here in the state.
Excellent. I think that those are excellent points. And you mentioned a little earlier about your staff and the accomplishments they've done in a year. And I'd love to hear a little bit more about how you're staffed and how you've managed to do this with what I would consider pretty thin staffing. And I know Lakeisha has some experience kind of in other states. Why don't you share a little bit about your thoughts about the staffing and your experience as a one-year employee?
Absolutely. I mean, it is interesting when I look sometimes, like you said, at our numbers and the growth. Just we've got over 3 million patients now in our master patient index. I look at the number of provider organizations that we've been able to onboard. For our first year of the mandate, we were really focused on hospitals and labs. So, so excited to say every one of the hospitals has started the process. Many of them are live in production now. But to your point, Dr. Agresta, that's with a staff of about 12 people. And we've got an awesome technology partner in CRISP, what we call CRISP Shared Services now. And we call it shared services really because there are several HIEs that really leverage a lot of the same technology backbone, but then we're able to really customize for the needs of our state, so for the needs of Connecticut. So really has been exciting. Our group of 12, and keep me honest, Jen, because I think we're at 12, but I know we're also hiring some folks looking to bring on a project manager to help with this next, what we call our year 2 providers, which is essentially building on to the hospitals and labs, but now we want to try to connect the rest of licensed healthcare providers and active healthcare providers in the state of Connecticut. So, been able to get a lot done in this first year, but definitely looking to amplify the message. And thanks for those that are listening to the podcast. Please continue to let others know about Connie. We've got a lot of information on our website, which I can share. It's the kind of the whole onboarding process there. But that's the staff. It's a mighty staff of 12. And great technology partners. And we've been able to get a lot done, but still got a lot more work to do with onboarding all of our healthcare providers in the state.
I can just jump in. I think we might be a mighty staff of lucky 13 at this point. I just counted that 2 seconds ago. But I think I give full credit to our COO and our sort of interim executive director, Michael Matthews, that we had at the beginning. We really tried to leverage flexible staffing as much as we possibly could, rather than trying to load up with a lot of staff. So we do lean on our technology vendor a lot. We do lean on other organizations to help sort of fill in the gaps where there might be a need within Connie. So I think we've been able to be very lean and very flexible, which I think has held us in good stead in this time.
Yeah, that's excellent. And I got to ask, what was the most important achievement or milestone that you had in this last year?
I think so. Lakeisha and I were talking about this a little bit. I think for me, just getting it off the ground, because I have been in Connecticut healthcare for a while, I have sort of seen some of these other attempts at an HIE. And so I think, I had the same skepticism maybe, or the same concerns as other folks did, that perhaps this wasn't going to get off the ground. But for me, the biggest achievement really has been actually going live and actually seeing data flowing through Connie and getting organizations onboarded. I also really like to talk about Bristol Health, who's really been just a pioneer and a great partner for us. Our hospital partners have been amazing, but they've really gotten most of their data in Connie and have even sort of worked to leverage Connie as the provider portal for their community providers. So recently, their provider portal either went down or their service on it was expiring. And what they opted to do was instead encourage all of their community physicians to get connected to Connie so they can get access to the data that Bristol was sharing with Connie. So I think that sort of exemplifies the type of partnership that we're looking for. And I was so excited when that happened and I heard that was what Bristol Health was doing. Lakeisha, I don't know if you have other examples of what you think that some of the biggest achievements were.
Yes, when I kind of reflect on the year, so on the account management team, we really do work really with every single organization that kind of comes through the Connie doors. That's the first step when you reach out on our website and fill out what we call a commitment to connect form. The first thing that happens after you fill out that form is you're assigned a Connie account manager that really stays with you, not only throughout the onboarding process, but even beyond that. After you're connected to Connie, we're still reaching out to you every quarter, if not more often, just to make sure that you're up to date and that we're really meeting the needs of what you're working on towards your healthcare goals. So I think one story that stood out to me was one of the providers when I came on board in last August. kind of coming toward the end of some technical assistance dollars that we had from CMS. And so, as part of that technical assistance program, we would help providers get connected to Connie. And one provider that stood out to me was actually an eye doctor that, his office manager told us, and I think she kind of, almost like whispered it. She's like, "We're still using floppy disk." And so, we were kind of like, wow, that's technology we hadn't really seen here in some years. But it was through that program that we were able to help them get an electronic health record system to actually help them, give them some tips and some other recommendations when it comes down to workflow. So it was just awesome to really be able to meet providers where they are. And I think that's really been kind of our staple as we're onboarding providers is, understanding where a provider is in with technology. Typically after we sign data sharing agreements, your account manager will meet with you to talk just around how are we going to get you technically connected. And I think many organizations are actually surprised at just how flexible we can be with connecting, to your provider organization wherever you are in the process. So that provider really stood out to me to get them in what I consider like our healthcare ecosystem, where they're able to now share data and access data and offer the floppy disk for that matter.
Wow, was that a 5.25-inch floppy disk or the more recent ones? It just reminds me that like we were having a conversation with friends recently, and we shared how much of our lives is still on VHS tapes, like our marriages and things like that, and how we need to move those things into a sort of more digital format. And I think that's true for healthcare. There's still a lot of things sort of trapped on paper and in other places, and making it interoperable in digital ways is a lot more challenging than just making it digital. And I think that'll be some of the upcoming and really wonderful use cases you have in the works. And that brings us to the question of like, what use cases have you brought up? And use cases is a term that I'm not sure our listeners are going to be familiar with. And I wish I had a better way of describing it, but I guess the best way to describe it is tell us what's getting exchanged and for what reasons currently. And I know there's a use case that's launching, I think tomorrow, that I'm really excited about. So you can tell us that at the end. How's that, Jen? You can tell us what's going on.
Yeah, maybe I'll start. Lakeisha and I will tag team on it a little bit. So at sort of the heart of Connie at the moment are some really basic core use cases. And a use case is really just sort of discrete use of data. So it sort of describes the type of data that will be provided and then what it can be used for. And so Connie's use cases at the moment are all sort of HIPAA permitted purposes for treating providers to have access to information so they can take care of patients. And that involves a use case called empanelment. So at its heart, Connie is what we call a panel-based system, meaning you tell me who your patients are and who you have an active treatment relationship with. And that providing that data and information allows us to do a couple of things. One, it allows us to set up relationships in the background, right? So again, at the heart of this, I feel like relationships and providers and their patients are sort of key here. But that tells us who the relationships are. And that tells us who you should have access to, right? So I will often tell the story that my primary care physician is Alina DeBrita and my OBGYN is Renee Cortland. Both of them have me on their patient panel or roster. And sharing that panel or roster lets Connie know that both Dr. Cortland and Dr. DeBrita should have access to information in Connie about Jen. So that's empanelment. Then we also have clinical data, which is a pretty broad use case that allows for the sharing of clinical data for providers to be able to treat their patients. And so it varies by sort of type of organization you are, but typically for a hospital, let's take those because we've been working with them so extensively, that will mean real-time, what are called ADT messages, and those are admit, discharge, and transfer messages. That will let us know when patients have been admitted, have been discharged or transferred within a health system. There are CCDs, which are continuity of care documents, which are sort of summaries of episodes of care. So once I leave the hospital, that summary of that episode can come to Connie. There are both lab and radiology feeds. So your lab results and your radiology results. There are also radiology images, which is one of my favorite use cases because through the clinical data use case, we now have the ability to get images and be able to share those images. So the challenge that I had a few years ago will go away as we get more organizations sharing images within Connie, and then my treating providers can simply log into Connie and see those images that they need. And then I feel like I'm forgetting one, but those are transcribed documents. So discharge summaries and the like are in there. And then Tom, you referenced the one that's going live tomorrow, and you've had sort of an instrumental role in helping bring this to fruition, but this is the best possible medication history. We're really excited about this because when you have a CCD, so for those who don't know, a CCD I like to think of as like a PDF summary of a visit. So Jen went to see Dr. Agresta. When Dr. Agresta is done with his notes, he closes up that visit and a CCD is produced. And it's a wonderful document because it has a ton of information about my problems, allergies, medications, immunizations, what diagnosis I had at that visit, what my course of treatment is going to be. But it's sort of in a PDF style document. And so it's hard. So when you want to sort of see a number of pieces of information about Jen, you have to open a bunch of PDFs. What we've been able to do is extract the medication. It's called parsing. We parse the medication information out of multiple CCDs and create a combined medication list. And through a group of clinicians and pharmacists, we've been able to say, okay, when we are able to parse this data out of the CCDs, all of this medication information, if we have the same medication, same dose, same provider time and time again, can we assume that's a duplicate? And can we roll that up into one sort of line on their medication history? Yes. But if we've got a different dose or a different provider, put that on a different line so that we can see the detail of that in the patient's medication history. So we hope to be going live with that tomorrow, all knocking on wood, it will all be available. But we're starting to see this ability to, I think Lakeisha said it earlier, sort of really enhance that data. So the data is there, but now we're pulling it and extracting it in a way that allows a clinician and ultimately a patient at some point to be able to see that data in a much more meaningful way that allows them to do something with that data rather than just open CCD after CCD after CCD.
It really will make a difference in being able to understand what's likely going on with a patient. And I think those are the keys, are to make this useful in someone's workflow and make it visually and cognitively more capable of being used almost immediately. And I do see a lot of these potential use cases coming down the pike, and I'm really excited about that because, as we all know, healthcare IT has helped with some things and has created burnout in some ways because of sort of information overload and information not being as readily available. So I'm going to turn to Lakeisha a little bit, and I'm going to ask her, in talking with any of the clinicians that you've helped onboard, can you share with us a story about a clinician who has kind of come back to you and said, wow, this has really improved my ability to care for a patient in some fashion? The thing that starts to matter, like why do we want to do this?
Yes, I think about just kind of piggybacking off of different use cases. One other use case that we're starting to roll out now, we've kind of piloted it, is Encounter Notification Service, or ENS. And to your point, Dr. Agresta, whenever we talk about alerts, it is something that we really try to get as specific as possible so that providers aren't getting alerted about everything, but really being alerted around things that are meaningful and actionable to them. And so what's nice about ENS, and especially one of the groups that we recently piloted ENS with, is that we can really get specific. I know for some of our providers, especially if they're in some type of bundled payment, many times they'll need to know when a patient, if a patient has hit the emergency department or when they've been transferred over to a SNF, so that they can make sure that they're reaching out to that patient. Kind of prior to Connie, sometimes many of them have not had a great way of being alerted, or they'll find out after the fact, oh, my patient was in the ED, I had no idea. So I think that's definitely a use case we've been happy to pilot with some organizations. And really, our vendor even is talking with us about doing what we call smart alerts, which is really getting more specific with specific types of alerts. So I think, as you talk about things that we have now, which we do have ENS available, Encounter Notification Service available now, we call it Prompt, but that's available now, but we're also looking to enhance that even more. And I think as we're working with pilot organizations, we see some really nice outcomes there. We're looking at taking a lot of that data too and putting it in the actual workflow. So if you would like those alerts to go directly to whatever system, or if you have a care coordination group that you're working with, we can work with that care coordination group to make sure that by the care coordinator, they're getting the alerts that they need for the patients that they want to be alerted on. So really, really exciting things there. And I think we definitely appreciate what we call use cases, because honestly, the way that we build a lot of our use cases is from our participating organizations, what they say is important to them, and how can we help them once again reach their goals.
That's great. That's a great story, and it makes me think that what you're enabling is the smaller practices to take on and do things that only were possible in larger practice organizations before. You're really enabling, small primary care practices to potentially thrive again, which is critical, I think, to give people options as to how they want to practice medicine. Obviously, not everything is roses, and you probably face some challenges, both things you kind of knew were going to happen, and some things that were kind of curveballs. Can you kind of share a little bit of stories about some of the challenges you've faced and how you've addressed them?
I'll kick off with a couple that I think we hear on the account management side. So one, probably one of the very first questions that we encounter from organizations is there a cost to participate with Connie? So good news is there is no cost currently to participate with Connie. So that's always a relief for a lot of organizations. I will say, depending on your EHR, electronic health record vendor, if you have one at your organization, the EHR vendor may cost to integrate with Connie. So we do let folks know that up front, but we definitely try to eliminate the cost barrier as much as we can, and hope to keep that going, especially through some funding that we have received through the state. So that's been a question that we get a lot, but right now are happy to say that we do not charge to participate with Connie. I think the other piece or other piece of feedback that we get a lot of times from organizations are, if I don't have an electronic health record, or maybe my EHR is very limited, that sometimes they're wondering if they can get connected to Connie. So I think just the question around how technically can I actually get connected? And I think that's been really evolving for us too, especially when we think about Connie, the way we like to describe ourselves, the network of networks. So some organizations, many times their EHR may already be connected to a national network, like an eHealth exchange or care quality. So Connie's exploring how can we maybe get the data from data that you're already sharing, how do we get it into our network? Or if you don't have an electronic health record, we still can work with you, being a panel-based system, to really be able to fill out, it's essentially like an Excel spreadsheet of these are your patients. We can set you up with a secure, what we call direct secure messaging, where you can securely send that patient information back to us, and we can get you started that way. So I think it's just been interesting hearing sometimes some of the challenges and how we're really trying to meet providers wherever they are with that technical flexibility, but then also the fact that there is not a cost to participate in Connie. Those are probably two of the things that we hear a lot, that we try to make sure that's not a barrier for entry. But I'll turn it over to Jen. I know Jen has been working really with patients and also patient access.
Yeah, I mean, I think that there's, if I can go maybe a little bit more esoteric, I don't even know if that's the right word, but some of the challenges that we face is because we've had so many fits and starts in the state of Connecticut, sort of breaking through to getting folks to believe that this is really working, I think can sometimes be a little bit of an uphill battle. I think we also have sort of 12 years worth of interoperability that we're trying to stuff into 2 years worth of a mandate, or sort of get going as fast as possible. And it's interesting, the more you talk to people, there are folks who think we are not going fast enough. And then there are folks that I think we're going too fast. So trying to navigate the, some of the, Lakeisha talked about the patient voice, right? And I hear often from patient advocates and consumer advocates who are tired of charting or sort of tracking all of their charts from provider to provider and want the ability to be able to share this information because they're sort of managing it all and it's a burden for them and they can't get to us fast enough. Like, let's get going, let's move. Why isn't my data in here yet? All the way to the other side of privacy advocates, right? And folks who are looking out for that, who want to make sure that data is shared securely. And so sort of trying to manage the balance of that across all of the organizations that need to connect, I think can be a challenge for us as we try to navigate it. So there's a lot of those sorts of additional challenges other than just the sort of really practical of, well, how much will this cost? How long will it take? What do I need to do to get connected?
And I would concur. So one of the reasons that we had challenges in some of the earlier efforts, and Jen knows this well, that I was involved in some of those earlier efforts at HIE, really did relate to not kind of answering those questions effectively and kind of making the business case, not so much to technology, but the, answering all those questions and kind of paying attention to all those stakeholders. So it's really important to do that. And while we're doing that, we're going to take a brief break to kind of hear a word from our sponsor, which happens to be Connie. So I'm going to give a pause, and then we'll come back and talk a little bit more about the process around getting connected and things like that.
We want to take this opportunity to thank Connie, Connecticut's official health information exchange. Connie was established in 2019 to oversee and provide services to support the exchange of health data in the state of Connecticut. Connie is an independent and not-for-profit organization. To learn more about Connie, please visit conniect.org or go to the show notes from today's episode.
All right, so as we return from our brief messaging break, I want to have us walk through a little bit about what does it take to get onboarded? There are organizations and people that are going to be listening to this who are saying, I want my organization to join, or I want my practice to join. Well, walk us through a little bit of that process, Lakeisha.
Yeah, absolutely. And I think probably the best start for onboarding is on our website, which is www.conniect.org. So just think of Connie, Connecticut.org. And then from there is what we try to put this, our onboarding process into a 5-step infographic. So that's something that's downloadable and there for organizations to reference. But really the first step, once you get to the website, is letting us know you're interested. And that's what we call our Commitment to Connect form, which is available right on the website. So that's your step one. But as soon as you send in that form, automatically you are assigned to an account manager for your organization that will send you data sharing agreements. We'll work with you to, the data sharing agreements are really helpful in understanding, one, what kind of data you will be looking to contribute, but then also just some of the rules around accessing data, et cetera. A lot of that is laid out in our data sharing agreements. You'll get also a link to our policies and procedures, et cetera. So that really helps to set the groundwork for data sharing. So that's your step two. Once you send that back in those documents, our step three is actually discussing technically how you're going to send and access data from Connie. And then that gets you to step four, which is actually after you've gone through kind of your data sharing, we've talked with you about how you're going to connect, is step four, we get you connected. And so a lot of people, they feel like, oh, okay, great, I'm connected, I'm good to go. But we did add on a step 5, which is really let's keep in touch. And that's as we talked a little bit earlier around use cases and just making sure that Connie's bringing valuable data and valuable services to you. We want to stay connected with you. We want to keep in touch to really make sure that we're helping to contribute to our healthcare ecosystem, and ultimately that patients and you have the healthcare data that you need right at your fingertips. So that's kind of the 5-step process, but really, like I said, just data sharing agreements. We'll make sure we get those, talk with you about how you technically get connected. We'll get you connected, and then we'll keep in touch.
Excellent. It's really sort of a hand-holding process from what I gather, right? And you've got it pretty well smoothed out from folks that I've talked to. The other thing you kind of mentioned is staying in touch. And I think one of the things that is really critical about being successful is really having feedback from end users, participants, thought leaders, et cetera. So Jen, maybe you can share a little bit about how that occurs for Connie, what kinds of structure you have to get feedback and input from Connecticut stakeholders.
So Connie was always built with the idea that we were to engage our stakeholders in the organization. So we have a number of ways that we do that, all the way from an appointed board of directors that does represent sort of a cross section of the healthcare industry, including patients. We have an operations advisory council that is really organizations that have signed on to Connie and who are willing and able to give us feedback. So we meet quarterly, we give them a sense of where we are, what we're doing with use cases, and really ask them for that feedback on what's working. Are you getting the communication that you need? Did you understand this use case? Where are you struggling with? Those kinds of things. We also have recently started a clinical advisory council that you're helping lead and take off for us, which is really clinicians providing that same feedback for us on what's the value of Connie, how does it work in my practice? And then we hope to, by the end of the year, start a patient and family advisory council. So a group that's really advising us from the patient perspective, especially as we look at rolling out access to the data in Connie to patients, which has been a key part of our mandate and is what I think is critical, because I really think Connie is about empowering healthcare, both for the provider and for patients. And so we want to make sure that we have that patient and family advisory council to help us as we roll that out and look at how we provide data and share data with our stakeholders.
Yeah, it's excellent. And I think it takes a lot of energy and work to kind of stay connected to all those stakeholders, but I think it also is what will make Connie successful and will make the use cases, the things that are done, really of value to the healthcare providers and the patients and the state as a whole. Can you share anything that you might think are misconceptions or things that is conflicting information that you want to correct, that you're aware of is out there in the ecosystem?
Yeah, thanks. I think that one of the biggest areas or misperceptions that is out there is this idea that anyone can sign a use case agreement with Connie and just start trolling around in the data and looking anybody up, their neighbor, their ex-husband, whatever. And that is simply false. As I said at the beginning, Connie is a panel-based system. You have to be either a HIPAA covered entity or a business associate. You have to have a treating relationship or a reason why you're going into the data. And it's tracked all the way through from your login to where you were and what you were looking up. So it is not a matter of Connie selling access to the data to the highest bidder. That is absolutely not the purpose of the HIE. So if you are in Connie, Tom, if you're logging in and taking a look at patients, we're tracking and are able to see who you're looking at and why you're looking at. And in fact, if we don't think you have a reason to be looking at that patient, we'll put a stop up. It's sort of known in the industry as break glass, but we'll stop you and say, hey, we don't know why you're looking at Jen Searles' record. We don't have any record of you having a relationship with her. And you will then have to attest as to why you're looking at Jen's record. And that might be, as you know, Jen might be a new patient for you. And so you've not yet been able to send Jen in on your roster and let us know that she's a patient. But we want to make sure that we're tracking and keeping you aware of and alert of that. So I do think that is a big misperception that either the state is going to have access to all of your data, because the state is definitely a stakeholder in this process, or that anyone can sort of get access to your data and look at it, and that we're just sort of open to the highest bidder. And I want to put that to rest, because we don't sell data and we don't have use cases where we just open up the system for anybody to be able to access. We take our role as sort of trusted stewards of this data very seriously.
I know that way. One of the main goals, I think, early on in working towards an HIE in Connecticut was to make it such that the patient was the North Star, and that's one of the things, to respect that relationship. And I do think it's wise to have this sort of break glass opportunity, because someone has an accident and they go to the ER in a town that they're not being treated in. You really do want that capacity to kind of not cause an allergy, not cause an allergic response to something or medicine you're giving. So it's really an opportunity to sort of improve care, but do it in a thoughtful and protected way. So I think those are great things. I'm going to ask what are you kind of thinking about doing next? What's got you excited about next, steps? I'll start with Lakeisha.
Yeah, absolutely. I think as we think about healthcare data, it's great that we're kind of on this 2-year, timeline of like, hey, let's get many of our healthcare providers connected. I think what I'm also interested in looking at is when we think about what has been called the social determinants of health, kind of all of the things that make up your health, your housing, your employment, your food or food insecurity, interpersonal violence. Are you safe at home? Transportation. I think as we expand beyond maybe just clinical data and look at how do we also incorporate referrals to all of those different things that really make up a person's health. How do we really become a community, Connie, become the community that can either help make sure that providers are aware of that data as we think about also opening up access to patients in a meaningful way, that they also maybe don't have to tell that story over and over again as they get ready to go to various healthcare providers. I think that's what we're really excited about is really making, once again, this Connie, our healthcare ecosystem where you have contributors, but then you also are able to receive value from that data. That's exciting. I think too, as we work this year with what we call our year 2 providers, bringing in behavioral health and home health and dentists and eye care doctors and many of the providers that maybe don't necessarily traditionally see exchanging data back and forth, to have them all in one system is really exciting for us. So those are two: social determinants of health, looking at that data, but then also kind of the breadth of year 2 providers that will onboard this year are really exciting for us.
I think it's wonderful to be able to, think about sharing data with, behavioral health folks and dental folks and social determinants, people who are going to help with housing for my patients, et cetera. Right now, I think as a primary care clinician, we try to do all those things, but we have quite a challenge to share the data in an effective way. So this will be really it has to be crafted correctly, but I think it'll be an exciting kind of journey for us. Jen, you have anything that's got you really excited?
Well, I think, as Lakeisha mentioned, a lot of our focus has been obviously on getting providers connected and getting data into Connie, right? And that's critical because without that, none of this works. But I'm excited to look at where we go in the next couple of years of engagement around the data and sort of understanding where providers do see value in it, providers and patients, right? Because we are going to be opening up this data to patients' access at the very beginning. But sort of really being able to understand how people want to see and use this data. I also am working with a number of our CSS affiliates, and there's this concept of HIEs as really a health data utility, right? So an organization that really provides that cooperative and supportive relationship between healthcare providers and state agencies. And I know here in this state, we've got a number of state agencies doing really amazing work. But a lot of healthcare organizations have said to me, is there any way we can make this easier? If I have to be connected to you already, is there a way that then you can provide my data that I'm required to send to the state for? I'm making these sort of use cases up, but a lead registry, right? Or vital statistics, or any of those, maybe newborn screenings, right? Those kinds of things that are critical to public health. Is there a way that we can facilitate and make that easier? And I'd like to, over time, really get into that with our state agencies. And I think we have a great relationship with DSS, for example, and the Office of Health Strategy has administrative oversight. So thinking about how we extend that infrastructure to make that more efficient for organizations, I'm sort of excited about. And then just the patient access. I tend to think that the mission of all of this is really about empowering consumers. And the more I can give them access to this data, and the more granular I can get with that, and the more flexible I can be with the permissions that they want to extend around that data, I think the better that will be for patients in the state. So I'm looking forward to that sort of next set of challenges of incorporating patients into this process and allowing them to see the data that we have.
That's great. So as we sort of close out our conversation today, I'd ask each of you for kind of a final statement and for our listeners, and maybe any lessons that you've kind of learned, but also what you'd like to leave our listeners with as thoughts for the future. So Lakeisha, we'll start with you and then go to Jen.
Yeah, thanks again, Dr. Agresta, for having us on today. It's been great to kind of reflect over this past year, and then also exciting to think about the path forward with Connie. I will say, just as a last statement or reminder, is please check out our website, conniect.org. And there you can really find a lot of the information that you need if you're new to Connie. Dr. Agresta, I think you brought up a great point about that feedback. One of the things we recently added right on our homepage is a feedback button, essentially, that you can just push, and that way you're able to it launches a survey where you're able to, it's quick. We kind of put it as I think it'll take about 3 minutes or less, where you can give us some feedback directly there. But our website, we really do try to make that more of a one-stop shop where you can find a lot of information, hopefully pretty easily, in order to stay connected with where we are with Connie, and no matter where you are in the process. If you're a new organization and you want to learn more on our website, you can literally, there's a button that says learn more about Connie. You can get an invitation to our monthly webinars. We do host a webinar for new organizations. We call that the Connie Overview on the last Wednesday of the month at noon. Even if you can't attend in person, please go ahead and you can register for that, and we'll send you the recording once you register, so you can watch it in your own leisure if you can't make it live. But definitely our website's a great place to go. And I think the last thing I'll just close with is one of the things I like to say with our team is that we're here to serve all, but ultimately we're here to serve you. And I know that sounds a little bit of an oxymoron, but it's as we look at our healthcare ecosystem of, like I said, looking at contributing data, but also being able to access data, especially as we're working with our year 2 providers, we really want to be able to understand what is it that behavioral health providers need? What is it that dentists need? What is it that EMS or a lot of the other providers that maybe have not been a part of a system like this before, what is it that they need? So as we bring this all together to really serve all, we also want to make sure that we're hearing the voice of the individual providers and patients, for that matter, as we bring them in. So appreciate the time. Definitely would love to stay connected. And thanks for having us again today.
And if I could just sort of, for me, at the heart of this, Connie, is empowerment. And that's empowerment for consumers. It's empowerment for providers and healthcare organizations. And hopefully at some point it will also be sort of empowerment for everyone in the healthcare ecosystem that maybe has been a little bit removed from all of this. And I see the power of that, of data, and how it can be used for effective healthcare decisions, more timely healthcare decisions, and better healthcare decisions. So I'm excited for sort of the future of Connie and for the future of healthcare in Connecticut. So definitely our website is the best place to go. We can get you connected, we can get you more information, and we can sort of guide you on this path.
And as I am excited, and it's a pleasure to have you, Jen and Lakeisha, on today's podcast, and look forward to kind of watching and seeing what's happening and helping to shape the future of healthcare along with you. So looking forward to year 2, and I'm sure going to be around and ready for that year 2 celebration.
Thanks, Tom.
As always, wishing you the best of health. Your host, Tom Agresta.